belonging to the dental society is incredibly important to me. But I think that we still have more room for improvement in our way that we interact with both the younger dentists and with some of them that
Sure.
are a little more seasoned.
Do you belong to any ethnic group?
Alpha Omega,
There you go.
which is the International Jewish Dental Fraternity,
There's-
which has done great things. And
course.
and I'm part of this. I mean, they founded both dental schools in Israel, something that most Jews are proud of and happy about.
Yeah.
But we try very hard to make the younger members feel welcome. It seems to me that should just be a natural evolutionary
Absolutely.
thing. But I'm looking back and thinking about how does a young dentist get involved? And I think the first thing is you have to join. You're out of school, you're worried about your first loan payment, you may or may not have a family or a family on the way. You have to join. You are going to have to take that first step. You may be invited. Wally, if somebody invited you to your first meeting, somebody invited me to my first meeting. Today, in the age that we're in, where everybody depends on social media for things, I think that we have to start by joining. And some of that may come from within the person. Mm-hmm. I mean, everybody that I know has taken some psychology at some time. And everybody is not, to use Abraham Maslow's terminology, everybody's not self-actualized.
That's right.
You know,
Oh,
you
God,
have
that's-
to jump in at some point. You have to go to your local meeting, the one that's being held at the restaurant that's a mile and a half from your office.
Yeah.
And if somebody doesn't come up to you, then you have to walk up to somebody. I mean, something's got to come from within you. And it's not a bad lesson, by the way, to learn about taking care of your patients, because if you just walk in the room and you don't speak to your patients,
Well,
you're not going to have much of a practice. So starting all membership issues, all inclusivity issues are local. They start with your branch. Meet the people
That's a great line.
are near
That's a wonderful line.
are near you, that live in the same neighborhood maybe, that practice in the same neighborhood, chances are. I think that's the first step. And I think the second step that I would say to a young person, granted I'm older but I'm still passionate, I hope that comes through. Raise your hand when they say we need somebody
Yes.
to be in charge of whatever.
First job was attendance.
Right.
You made an announcement how many people signed
Exactly,
the
right.
roster.
And I think that whether you become the dinner chairman of your branch, or whether you become on a committee, you have to volunteer.
Yes.
It just takes that motivation, and you have to show that. It's the same motivation that made you choose dentistry in the first place. You had to make the application to the dental school. They didn't come out to your house and knock on your door
No.
with the application.
Not at all.
The self-starter, the self-actualized person, is where it has to start. And if you're not at the top of Maslow's pyramid, then you got to start working toward that, because you'll need those skills as you mature in dentistry. And I think that getting involved first at your branch by joining, and then by volunteering. And once you do that and people see that you're willing to work for the profession, then you will feel much more comfortable in the dental society, the Chicago Dental Society setting. Because when you go to the midwinter meeting, and I often found it difficult to understand somebody that wouldn't go all 3 days to the midwinter meeting with the most fantastic.
Blows your mind.
I've talked to a young person, I'm only going 2 days, I'm going to be in the office on the third day. They don't belong in the office.
No.
They belong there.
There's more to
Because there's much more. They develop their interpersonal relationships. They get knowledge by going on the exhibit floor and having a one-on-one conversation with the guy that's promoting this new scanner or this new digital radiography. It doesn't happen if you're in your office using your old X-ray machine.
Right.
You've got to be out there.
You need it for your patients. It's absolutely
Without a
If
doubt.
you don't have a bedside manner, you can't converse with your patient.
And Wally, that comes from confidence inside of you. If you're a little bit shy, and most dentists, by the way, are a little introverted,
Sure.
if you get out there and you realize that meeting people is you're building something for your practice and for your own self.
Right.
It's very significant as I look back at how shy I was and how I knew that I couldn't.
Can't believe it.
True, I knew I couldn't live that way.